Hi, I'm Alex Collie. I'm the Director of the Healthy Working Lives Research Group at Monash University. We lead research, education and training in work and health. Our aim is to prevent worker injury and to help workers recover after injury and illness in the workplace. And we also study compensation systems, income support systems and healthcare systems to identify ways they can be improved. This year we're launching our Healthy Working Lives seminar series. This is a series of 6 events between March and June. You'll have the opportunity to hear from our research experts as well as experts from industry. These events are free to attend and you can log in from anywhere, your home office, your work office or wherever it is that you find yourself. The seminar series will focus on the COMPARE project, which is a project established here at Monash University in 2014, which has been running continuously since then. We've been very fortunate to have the support of every state, territory and Commonwealth government in Australia. The project seeks to develop evidence to improve return to work policy and practice in Australia with the ultimate aim of improving worker outcomes. The COMPARE project was established to take advantage of a natural experiment that we have in Australia when it comes to return to work and workers' compensation. Every state, territory and Commonwealth government in Australia has at least one workers' compensation scheme. And while they share many common features, they also differ in important ways. And policy and practice also changes quite regularly. With the COMPARE project, we exploit these differences to look at different outcomes in terms of return to work and health between different compensation schemes, between different groups of people who are involved in those compensation schemes, and also before and after changes in policy and practice. And doing this allows us to produce really high quality evidence about what works to help people return to work and how the things that we do in compensation systems and in return to work process influences those worker outcomes.
Hello, I'm Dr. Mary Ward, an occupational physician. It's important to understand how policy impacts work schemes and impacts workers. We all have our own views about what should be done and what should be improved. But the field is complex and we need research to help us understand how we can improve. The COMPARE project makes a significant difference in helping us understand the impact of policies. What works, what doesn't work, how can things be improved? Alex and his team have the smarts and the statistical capabilities to look at big data sets and complex ways of understanding the outcomes of policies. I'm really looking forward to the Healthy Working Lives Research Group presenting their findings and their important work.
In the COMPARE project, we've been fortunate to have access to a lot of national workers' compensation and survey data provided by our partners. And that has allowed us to produce an enormous amount of evidence and information over the years. 21 published peer-reviewed journal articles, 15 reports to industry and government, more than 40 academic and industry conference presentations. The Australian labour force includes about 13 million employed people. They're covered by 11 major workers' compensation schemes that provide insurance coverage for nearly 12 million workers. Just over 500,000 people had a work-related injury in 2017-18. There are nearly 250,000 accepted workers' compensation claims every year, and of those, nearly half of the workers have at least 5 days or more off work. The annual economic cost in Australia has been estimated at just over $60 billion, which is a little bit more than 4% of GDP. This research is important because a lot of Australians are involved in workers' compensation systems, or they have injuries and illnesses that affect their ability to function at work. The findings and results presented in our Healthy Working Lives seminar series should be of interest to lots of organisations in Australia, including workers' compensation regulators and insurers, employers, people involved in the care and support of injured workers such as healthcare providers and occupational rehabilitation providers, and of course injured workers, their carers and supporters. By attending these events, you'll be able to stay up to date on the latest research evidence, get a better understanding of how you can use that research to improve return to work, and you'll get an opportunity to meet the researchers and the industry experts who have been involved in this over the last 8 years.